Hello, and welcome to another Arthritis Help Movement Improvement session where you learn to move differently so you can feel better. I'm Dr. Dave, physical therapist, and today we're going to be talking about management of Sacro Iliac Joint Dysfunction, or SI joint dysfunction. You may not know what the SI joint is, so I've got my little pelvis right here to help give a quick anatomy lesson. This is a pelvis. And this is the pelvis, and these are the thigh bones, making this the hips, how they move back and forth. And right in the front here, this is actually the front of your low back or your lumbar spine. And then if I turn this around, you can see this is the back of your lumbar spine. And this bony plate right here is called your sacrum. And this bone of the pelvis is actually called the ilium. So where the sacrum attaches to the ilium is your sacroiliac joint, or your SI joint. It's a very interesting joint because it's pretty large. It spans all the way from here and then all the way around the front. It's actually one of the largest surface area joints in the body. And its job, unlike other joints, is not to move so much, but it is to transmit force from the legs into the pelvis, into the spine, to give you stability when you're moving or standing or propelling yourself forward. You can get pain in that area when, instead of that force going up smoothly through the joint, it comes kind of offset and creates a shearing force through the sacroiliac joint, and then that will create irritation, inflammation, and ultimately pain. And that occurs very commonly when the pelvis gets a little bit forward tipped on the body. And so sometimes people have tight hip flexors, or they like to bend from the hip, and that will pull their pelvis forward, and it will arch their back backwards in order to maintain upright. And then the force goes through, I'm exaggerating here a little bit, but it goes through the thigh and then up into the sacroiliac joint in this forward tip position, which creates shearing and pain. So restoring that pelvis to this upright neutral position helps to get that nice cleaner movement through the body. So today we're going to work on a couple of exercises that will allow you to extend your hips without arching your back, to try to restore comfort and neutrality to the pelvis and the SI joint. Pretty simple exercises, but pretty complex concepts. So all you're going to need for this is a comfortable place to lie down. So let's get started. Okay, so we're going to start lying down on your back with your knees bent, and you're just going to feel for the ability of your low back to kind of comfortably rest down into the surface, into the floor if you're lying on the floor, or even in bed you could do this, so into the mattress. And I want you to feel how much space is between your low back. You know, if I were to slide my hand under, it slides much easier here than underneath the hips, because the pelvis is going to have this really firm connection to the surface, and then the low back a little bit less. Some of you might feel that your low back rises up quite a bit, others maybe a little bit less so. And then what you're going to do from there is just comfortably roll your pelvis backwards to flatten out that space in your back, and then release and roll the pelvis backwards to flatten out that space, and release nice and gently. I want you to make sure that you're really searching for every segment of the spine and not just the upper ones. It's real easy to kind of roll into this mid part of the spine, but really look for that lowest part of the spine that maybe is a little bit reluctant to find the surface, because that's where a lot of the sacroiliac joint dysfunction comes from, that inability to get that lowest part of the spine into flexion, which is this position of flattening down. And then I want you to do the opposite. You're actually going to roll your pelvis forward and arch your low back, so create more space back there, put a little bit more pressure on your tailbone, and then you're going to roll it, reverse it right down, roll it back down into the table. And so let's do this backward and forward kind of rock of the pelvis. Tip the pelvis forward, make a big space in your low back. Tip the pelvis backward with a little space, no space between the surface and the low back. And take it slow and only move as much as is comfortable. Just go to your natural endpoints. Don't try to fight to get another centimeter of movement or another inch of movement down this way. Nice and easy rocking back and forth. Do not put yourself into any pain. Remember rule number one, Rule number one, always be kind to yourself. So don't work into pain thinking that you're helping yourself. You're not. We're just rolling that pelvis back, the lowest part of the pelvis down, and then forward just to get a sense of how the pelvis moves. Okay, and now the next iteration we're going to do is we're going to take our hands and clasp them right over the knee, if that's comfortable for you. If that's not, you can go behind your knee. And if that's not comfortable, you could always put a towel behind your knee or just grab your pants a little bit. But whatever you can do and pull in that leg a little bit towards you. I'm comfortable over my knee, so I'm just going to interlace my fingers and clasp. I'm just going to pull that knee back into my chest a little bit. Not pulling as hard as I can, just back to where I feel that first point of resistance. Okay? From there, what I'm going to do is I'm going to put pressure through my left heel to help roll my pelvis back and allow that knee to come a little further. You can see that when I roll the pelvis backwards, it gives freedom of the knee to come a little bit further back. So if I have the pelvis here, or if I make a lot of space behind the back and I try to pull in, the leg isn't going to go very far, and you might even feel a little bit of pain or pinching in the crease of the hip. If you're feeling that, what you need to do is just press through the heel that's in contact with the floor, flatten out that low part of your back, and feel how that releases the hip to move backwards and the knee to move upwards towards your nose, not back into your chest, but almost overhead. And so let's just do a few of those, nice and easy, rolling the pelvis back and feeling that nice continuity between that pelvis roll and the knee going back into towards the head. And you might even feel you get a little stretch, maybe in your low back. That's okay if you do, or if you don't, no big deal. And this is going to loosen up your back, and it's really nice to loosen up the hips as well. Remember, this isn't stretching. We're not pulling. We're just finding cooperative movements that we can create that are going to allow you to move a little bit more freely and a little bit more easily. Okay, as you do this, remember, we're searching for that low part of the back and not just rolling into the higher parts, but finding that low part early so that knee can come back towards the nose. Very nice. Okay, you're going to let that leg down and rest a minute. You can even straighten out and shake it out if that feels a little bit more comfortable for you. And then we're going to get back into the same position. Knees up. And now we're going to do one final move here, and this is the big one, the tricky one. So what you're going to do is you're going to grab the knee just like you did before, interlace the fingers if you can. You're going to bring the knee back towards your nose. At the same time, you're going to press with your heel to roll your pelvis back. And then you're going to give a little extra press so that the pelvis rolls backwards so much that it lifts up off of the table or the floor, but your back doesn't lift up. So I don't want you trying to arch your back or lift up really high. That's not the point of what we're going for here. What we're trying to do is to continue to roll the pelvis backwards so much that as much of your back can stay in contact with the table as possible, or the floor as possible, and you're just going to get a slight lift of the pelvis because it's rolling backwards, but not because you're pushing and lifting it up in the air. So let's try a few of those. Bring the knee towards your nose. As you do, press through the floor to roll the pelvis back and give a little extra push so you're rolling towards the upper part of your spine, and you're going to feel the butt muscles working pretty hard in this leg that's on the ground, and then come down. If you start to feel a cramping in the back of your hamstring, that's not uncommon in this exercise. If you feel that feeling, just straighten out that opposite leg till that cramp subsides. And then I want you to think about doing more rolling of the pelvis and less lifting. When we lift, it engages the hamstring muscles behind the leg, and it will facilitate the cramping. When we roll, it engages the butt muscles, which is what we want, and it will relax those hamstrings a little bit. So let's try that again. Bring the knee back toward the nose, roll the pelvis back, finding each vertebra one by one, pressing through that heel so the pelvis rolls back so much that it starts to come off the surface, and you're still in contact, feeling nice work through the butt muscle and feeling this opening through the crease of the hip. When we come down, you can feel how the hip crease starts to deepen, And then as you come up, you'll feel that this hip crease starts to open, and we want to get really open through that hip crease, and being able to extend the hip and engage the butt without arching the back is really the key to offloading stress and strain through that sacroiliac joint. Let's try that one more time, and then we'll take a rest. Pull the knee back in towards the nose, roll the pelvis back, press through the heel that's on the ground, feel the crease open up in the hip, feel the butt muscles engage, hold for a few seconds, and release. If you feel any stretch in the front of this thigh, the thigh that's with the foot on the ground, that's normal. That's a stretch of the hip flexor muscles. That's okay to feel. Okay, whew, that is very hard work. Let's take a moment and relax. You can straighten out your legs if you want, shake them out, and we'll try the same thing on the other side. So we're going to bend the knees again. This time we're going to, again, start with just a couple of little pelvis rolls just to feel that forward back movement to get nice and warmed up. And then we're going to grasp the opposite knee. For me, it's the left knee. I'm going to hold in front of the knee, but again, you can hold behind the knee, or you can use your pants, or you can use a dish towel to hold, whatever is comfortable for you. You're just going to gently bring that knee back towards your nose to feel its natural end point. I'm a little stiff in the hips, so if I'm not doing anything extra, this is about as far as I go. I could pull further, but I don't want to do that. Just as far as I feel that first resistance. And then once I get to that point of resistance, I'm going to press down through my right leg, which is on the floor, and I'm going to roll my pelvis back and feel how that knee comes a little closer to my nose. I'm not trying to lift the pelvis here. I'm just rolling backwards, seeing how I can use my foot that's on the floor to free up my left knee to come towards my nose. So I'm pressing down with my right to roll the pelvis back and get this left knee a little closer to my head without really pulling with my arms. It's not the arms that are doing the work. It's the position that you're positioning your pelvis in by pressing through this standing leg. And if this is all you can do, this is actually really a nice exercise in and of itself to help to engage, gently engage some of the butt muscles, relax some of the hip flexors, and stretch a little bit of your low back. And so just do a few of those back and forth, nice and comfortable. If you're feeling a pinch in the crease of your hip, you're pulling too hard into your chest. You don't need to pull. It's just guiding with your arms and really pushing with the leg to get that knee up. Good. And then we'll relax. Shake it out. You can straighten out if you want. It'll feel nice after the hip has been bent for a while. All right, we'll come back into that position with the knees bent. We're going to hold on to the left knee again. And now we're going to do the exact same thing. Bring that knee close to your head to its comfortable end point. Push through the heel to roll the pelvis back. And then we're just going to amplify that movement a little bit so that we roll back so much that the pelvis lifts up. There becomes a little bit of space underneath the waist or underneath the hips, but not so much that we're trying to lift the back. It's not a bridge, it's not a lift. Okay, and then we'll roll back down, and we'll do those nice and easy a few more times. Feel that roll back and just that little bit of extra oomph. I'm feeling the pressure right down through my right heel into the floor, and that's helping to roll my pelvis back. The muscles that are doing the work are in my backside right here. That's what I feel engaging, and I feel stretching through the front of the thigh and an opening through the front of the right hip, and come down. Again, if you start to feel a cramp behind your thigh, just straighten out that leg. That stretch of the hamstring is going to alleviate that cramp. And then on the next exercise, the next repetition, you're going to think less about lifting and more about rolling back into the table. It's really about rolling the parts of your spine into the table rather than thinking about lifting off of the table. And we'll just do a few more of those. And come back. 2 more times. And woo, I'm starting to really feel those muscles work in the back of the thigh, so I kind of needed this today. Good, 1 more time. It's really nice to wake those guys up once in a while and remind them how much good they can do for you. Good, and come down and relax. Whew, very nice. And then you're just gonna straighten out your legs again and relax. And then give them a bend and just notice where your back is in relation to the floor or in relation to the surface than it was before. If your back was feeling like it was really popped up quite high, does it feel like you're able to flatten down a little bit easier? If you roll the pelvis back, does it roll a little bit closer to the floor easier than it did before? We have this greater ability to bend at the spine, which is really nice. Good. All right, so that is a relatively simple exercise that you can do, but there's a lot of nuance to it, so take your time when you're doing it. Don't rush through, really feel your body as it goes. I'm going to give you guys one more bonus exercise for this because I love hip openers, and this exercise requires you to be on your hands and knees. So if that is uncomfortable for you, it's okay to skip this one, but if you're okay in that position, this can be a really effective way to help stretch the hips, flexibility in the back, and take stress off of that SI or sacroiliac joint. Okay, so for here, we're going to be into the hands and knees. You notice my feet are hanging off the edge of the table. That makes it a little bit easier or more comfortable. If you're in a bed, you can do that, or if you want to put a towel underneath your ankles, that will make you a little bit more comfortable. I'm going to walk my hands a little bit forward, so not underneath my shoulders, but actually a little bit forward in front of my shoulders, just like this. And then from here, I'm just going to do a little bit of what our yoga friends call the cat-cow. A great little exercise. So you're going to feel just like we were rolling the pelvis on the table. Now we're just rolling it in space. So you're going to feel your back dip and arch, and then you're going to feel your hips tuck, almost like a thrusting position. And then we're just going to do a few of those just to get a feel for that position where we can arch and then we can tuck or thrust. Good. A couple of times. Now, on the next one, when we get to that tuck or thrust position, we're going to hold it there. We're going to stay there. We're going to walk the hands a little bit more forward, not losing that tuck. Keep that tuck thrust. And then we're going to shift the weight forward onto the hands, keeping that hip tucked and keeping it tucked all the way through, all the way through, all the way through, allowing the hips or the belt buckle to get towards the table into this press-up position. And then we're going to push through the hands to bring it right back to the knees. And we're going to try that again. We don't want to lose that thrust. If we stay with this kind of arch through here, we keep the hips bent. That's very common. That doesn't get us the desired effect we want. We need to go from here to this thrust position. Maintain that thrust position as you shift the weight forward onto your hands. Make sure you have strong arms so you're not sinking into the shoulders. You want to be kind of prominent with the chest, and let those hips come through. As you come forward, whatever you can do is going to be great. You can lift your head a little bit, and you're going to feel that this should be a stretch of sorts, or you're going to feel this very low into the base of the low spine. You're going to feel it kind of right back in here in the base of the low spine. Make sure that if you let go of that thrust, if you let yourself just kind of sag, you're going to feel that stretch come a little bit into the higher part of your low back or the middle part of your low back. If you keep that thrust, you're going to keep it low, closer to that sacroiliac joint, which is what we're going for today. And let's push back. We're going to try a couple more of those. So we're going to arch, and then we're going to tuck and thrust. And then we're going to maintain that thrust as we stay up over the hands, pushing strong elbows, strong shoulders, letting that pelvis fall forward. You can even lift your head. If you have a nice long neck, right, that's going to help. We don't want to sink in. You want to push the ground away with your arms and keeping that hip thrusted as you come through, and not lazy, not letting the belly kind of fall down into the table. We'll try one more time. We're going to come up, arch, tuck and thrust, and then keep that thrust as we come forward, pushing with the strong arms, even drawing in the belly button a little bit, so that way you can be in this nice upright position and stay there for a couple of seconds, and then push back. We can push back with the hands, and if you want after this to go into a little child's pose or a little what we call a prayer position, that's okay, pushing the ground away just to kind of reverse the back in the other direction just because it feels nice. Sometimes we're allowed to do things just because they feel nice. Okay, great. And so I like that as a complement to the first exercise because it works a whole different set of muscles. We don't have to engage the butt muscles in order to get that mobility in the second exercise where we do in the first. So it really helps you to figure out different ways of moving using different muscles, but both of them taking stress off of that low back, off of the sacroiliac joint. I hope you found that helpful. And don't forget to join me next week for a whole new exercise where you learn to move differently so you can feel better. Thanks, everyone.